I'm Dr. Amanda from AltaVie, and I'm going to talk to you guys about mastering movement milestones. Movement milestones are a whole category of movement patterns that babies are supposed to go through to help them develop properly, and we're going to chat about what those are, why they matter, and how you guys can support them at home. So, why do movement milestones matter? Basically, what a movement milestone is it's a movement pattern that is preset. It's a brainstem reflex that babies are born with that teaches how to go through these patterns. And that's why whether you're in downtown New York or whether you're in the Serengeti, we see similar movement styles and similar movement patterns, right? Babies go from tummy time to rolling to crawling to walking in a similar fashion regardless of those scenarios because these are pre-controlled patterns. So they're really important for our normal neurological development and our normal motor development. And going through those patterns in a specific sequence actually helps develop the framework within our brains to build bigger tasks on top of them. So it's actually going through a proper sequence of motor milestones is important for learning. It's important for reading, writing, arithmetic, all of our skills later on. It's also important for social emotional development because of how it lays the framework within our brain. So these things do matter. But that being said, I don't want you to have the impression that we're crazy strict and everything being exactly by the book all the time too. You'll notice in this little chart by the World Health Organization, you probably can't read the fine print, but basically it's showing you normal timelines. And normal timelines are fairly varied, right? The normal timeline for learning how to crawl, for learning how to walk, they're wide, months-long timelines. And so it's not like, oh my goodness, my baby's not doing something at exactly the earlier time I'm seeing their peers doing something. What's more important is that they go through the sequence in order. So it's much more important that a baby goes through, tummy time, rolling, crawling, walking. Basically, you've got to crawl before you walk. And if we don't crawl before we walk, then sometimes I've got to go back later with my school-aged children and go through those patterns again so that their brains work properly. Does that make sense? A little bit of sense? A lot of sense? You guys can interrupt me, ask questions, clarifications. If I start speaking Spanish or too loud or too fast or anything, let me know, okay? And really, big piece here too is this is baby's first language. Movement and sensory input are baby's first language. They're its first experience of the world around it. And it's what the bulk of our brain is built towards as well. Right? It's not all this intellectual thought. It's about movement and sensory input and how do we interact with the world around us. Good. So let's talk about tummy time. We'll get straight to it. And I will say too, shameless plugs of my own daughter throughout this entire presentation. Not because she's the perfect example of everything, but because I'm obsessed with her and I love her and I have lots of photos of her, so it's a good demonstration. So shameless plugs there. And in our handouts and everything. That's in all of our stuff. So tummy time, why does tummy time matter? Tummy time wasn't really emphasized as a super big deal until we developed the Back to Sleep campaign, which we could talk for a whole class on the Back to Sleep campaign and what all of that means. But now they've revamped it because what they saw is once we were telling parents to sleep their babies on their back, parents became very protective and a little paranoid and weren't ever putting their babies on their belly. So now we've upgraded it to the Back to Sleep tummy to play because we're seeing babies aren't getting enough floor time. And again, we could go through a whole class as to why babies aren't getting enough tummy time, why babies aren't getting enough floor time. But the bottom line is that this prone posture, this posture of laying on their belly and learning to bring their head up is very important for developing normal spinal curves. It's very important for developing normal muscle tone, which is going to be important for their posture later on and for head control. And it's a precursor to all of the motor milestones that are going to come next, right? They've got to, again, you got to be able to have this nice strong surfer posture before we're ready to roll, before we're ready to go on from there. So obviously it does help reduce the incidence of what we call non-synostotic deformational plagiocephaly, which is flat spots on the back of the head and funny head shapes, right? So this helps us prevent that. It's part of our treatment when we're working with that, but it's also very important for brain input and normal motor development. Okay? So how do we encourage it? So there's a reason I have this photo in here too. Sorry, I just forgot that's the one I put in. All my photos got deleted from me last night, so I just put all new photos in last night. So some of them are a little different than what we practiced. So start day one. Biggest way to encourage success in tummy time is starting right away. When baby is born, they have certain reflexes that actually make it so that their muscle tone's pretty strong. Quite often parents will remark at birth, they're like, oh my goodness, my baby's so strong. They're like holding their head up already, and you'll see that. That's very normal, that's very good. And you wanna start doing tummy time while they still have those reflexes. Because if you wait, then they lose those reflexes and then you start tummy time, they're going to hate it, right? They're not going to have some immediate success, so they're going to get frustrated, right? We don't want babies frustrated. We want babies happy. We want babies thriving. So start right away. Start often. It doesn't have to be a long time. It could be every diaper change. Every diaper change, you flip them over for 30 seconds. Go from there. You can let baby get a little bit frustrated, right? You don't have to rescue them right away, but obviously we're not going to go through baby just screaming and just tough it type of thing either, right? Very good. We got a good example back there. There's a good surfer posture with you, Kelly. Good job, Miles. So supported tummy time is another way if baby hates it of doing a really good job. Using a breastfeeding pillow like I had in the first photo is a great way of bringing baby a little bit more upright so they have a better point of view and it makes it more fun, right? So that's a really good way of supporting that. On a person, on chest or legs, so like on your lap, on your legs, or on your chest when you're laying down like this, works. The reason why I have this photo in here though is to cue me, to remind you that sleeping prone posture doesn't count and being in a carrier doesn't count. Those things are good, those things are totally fine, but they don't count in your minutes for your awake tummy posture, okay? It's cute when baby sleeps on grandpa, but it's not, doesn't count for his tummy time. Getting down on the ground with them and making it fun. Eventually, tummy time might actually be time where you get to go pee by yourself or where you get to go, you know, actually get a little bit of something done. But at the beginning, you should be down there with them and playing with them so that it's fun and it's not tummy time equals mom is leaving, right? That's a good thing to learn. Doing football carries, holding baby in your arm. Here's my baby doll. This is my baby. Holding baby in your arm, supporting under their chin, not on their neck. Dads often really like these kind of football carries. They're really handy and you get an extra hand, which is nice. Exercise ball. Do we have an exercise ball in here? Yeah, there's one in there. Dr. Anna Marie, do you want to grab me an exercise ball? I'll show you guys that one because this is actually a really great way to play with a couple different things. And maybe I'll just bring it up when we talk about crawling actually. And then a palmar press up. So a palmar press up is when baby is laying on their belly. This is going to run away from me. There we go. Baby's laying on their belly with their hands out here, and you flatten out their hands so they're not like a little fist, and you slowly drag their hands under their shoulders, and eventually what they'll do is they'll push themselves up. Right? So that's a nice thing to play with when baby's getting good on their tummy but they're not coming into that nice high upright posture. You can actually play with dragging their hands down and maybe even giving them a little support and straightening up those elbows. That's a good precursor to crawling, but starts with tummy time. Okay? All makes sense? I added a couple little troubleshoot areas here. Sometimes there's more of a reason as to why baby is not having success. So common complaints that we see in our practice, CT junction is the area right at the base of the neck. So if we see this area really stuck into flexion, it's not comfortable for baby to come up into that nice surfer pose. So sometimes we've got to address any issues going on in that area. The occiput is the base of the head. And again, if baby's stuck in flexion, they're not going to like this posture, right? So we've got to look at those patterns that might be a physical barrier that's reducing the success you're having with tummy time with your little ones. So those are the things we look at. And muscle tone. If baby's really low muscle tone, that's going to be harder too. It's going to take a little bit more practice, and there's things we do to support that. I know I talk fast, but I'm giving you as much information as I can throughout all of this. We're going to have some fun. Any questions about tummy time or about some of these hands-on ways, or what are some issues you guys have had trying tummy time at home? For those of you whose little one hates tummy time. Somebody's, yeah, I was going to say somebody's got to hate tummy time, right? There's always some. And so with this, the supported pieces are usually where success comes, or on parents is where that early success usually comes, right? Okay, beautiful. All right, let's talk about rolling. I didn't have a good rolling photo, so I just picked a cute photo of my daughter. So for rolling, so this is just an example of rolling patterns. This is a little later. This is not an early rolling pattern. This is a later rolling pattern. But rolling is a really fun one. Rolling, and there's actually 8 different rolling patterns: front, back, front, arm leading, leg leading, right? There's a whole bunch of different ways we can get into rolling. But rolling is very important for developing early spinal stability. So again, we're talking about posture later on, even core stability later on. It has a big role. It's important for being able to move your torso in different ways and still have stability. It's also one of the first times that baby experiences really moving through space and the fact that they're independent of their environment, right? Baby's not one and the same. Early on, baby thinks they're one and the same with you and with everything else in their environment. It takes some time to learn that. And it's also really important for vestibular, for inner ear development, and for balance. So there's different timelines as to when, like what rolling patterns look like. You don't need to worry about those too much. Just making sure that as baby is rolling, the biggest thing to watch is that they're rolling both ways, right? That they're not always just rolling to the right or always just rolling to the left, making sure that they're rolling both ways. That's the most common thing we see. Yeah, good job. So I'll show you that little rolling pattern here one more time, just because I want to point something out with it. So what I want to point out with this is you'll notice that it's her hip, her leg that leads, and then the whole rest of the body follows. And that's a really normal spiral rolling pattern. That's kind of what you want to see. Early on, you'll see a barrel roll. The whole body moves together. Eventually, it's a spiral that goes the whole way around. Yeah. You're only turning to one way. We're going to go over some practice pieces and just making sure that we're practicing both ways. Yeah, I have a good homework for you. Okay. So, how do we support good tummy posture? Good rolling. Setting up for success, we want to master tummy time first, right? If baby's not good on their belly, then they're going to have a really hard time learning to roll all different directions. Increase the floor time. Again, they just need opportunity to explore, and that's often the biggest thing that's lacking, especially with your second kids, because then floor is not a safe space, right? There's other children running around, but that is usually our biggest lack. Don't rescue them. Let them get a little bit frustrated. Let them struggle. See if they can problem solve on their own. We'll go from there. Doing gentle spiral stretches. This is Miles. Hi, Miles. How old is Miles right now? 5.5 months, perfect. Perfect time to talk about rolling. Yeah. So with rolling, you can start by encouraging really gentle spinal stretches. Where's the baby in the mirror? Basically grabbing one foot and pinning the shoulder and lightly stretching over to one side. Same thing, grabbing the foot, pinning the shoulder, and lightly stretching over one side. He doesn't like that side as much. That's something you would pick. And then what you're going to do is you're going to use that same stretch and just progress it the whole way until they flip all the way over. So grabbing his foot, I'm going to gently twist and pull away from him. I'm going to gently twist and pull away from him all the way over, and then he's going to roll, right? Like until he pretty much does it on his own. Eventually you'll just kind of touch his foot and he'll go, but early on you go the whole way. Good tummy posture. Their arms will probably be stuck in some different places. That's totally okay, right? Move them around, rearrange them, depends on your floor space. Going from belly to back, you're going to use the arms to support. So going from belly to back, I'm going to reach under his arm to grab his opposite arm and kind of thread the needle through the other arm. So if I reach under there, do you see more babies under there? There's so much. I reach under, grab his arm, and then I'm going to thread that needle through until he flips back over on his back. Good job, dude. You'll notice as I do that I am supporting his head. I don't want him to startle, right? I don't want him to startle when we're learning. Startle keeps us in survival mode. We're going to flip it back over this way too. Good job. So startle will keep him in more survival mode instead of in learning mode, right? We don't want him in high alert, we want him in learning mode. So again, reaching under and threading that needle through the arm. Good job, dude. So just practicing both ways. If you notice he's only doing one way, keep going the other way and keep playing with both. You did so good. Good job. So that's the supported rolling that I have up there, leading with the arm, leading with the leg, the gentle spiral stretches. That was a perfect demonstration of what that looks like in a real person. We didn't practice this, I promise. Staggered placement is when instead of just putting baby straight down, or picking babies straight up. When you put them down or you pick them up, you actually put them on kind of a funny angle, right? Like you put them down kind of sideways and then let them half roll into position when you're working at that. Toy motivation, so, you know, use the bait, encourage them along. Log versus spiral I mentioned. Early on, it's normal to see more of a log pattern roll where the whole torso goes by itself. Later on, you want to see what we were encouraging here, where you see this spiral twist and then the whole thing unwinds. Good. Repetition. In clinic, the things that we'll see here, restrictions in rotation in the neck, especially up high. It's most common restriction we'll see getting in the way here, because if baby can only turn their head one direction, they're only going to roll one direction. Right? If baby can only turn this way, they're only going to roll that way. So we've got to make sure they've got a full range of motion within their neck, and that's pretty much for rolling what we tend to see. And good. Last one, crawling. The thing I wanted to put here too, you'll notice sometimes animals, siblings, can be really handy for getting more floor time, for getting more exposure to explore time on that, as long as, you know, they're integrated and not just trampling over the other kids. Just as long as they're well-behaved animals, obviously. And then eventually the baby will attack the animals too. It kind of goes both ways. So crawling, like I mentioned, there's huge ranges of time for when these are normal. 5 to 12 months is your normal range for crawling. That's a huge open range. I usually like to see babies crawling between that 7 to 9 month, in the middle of that, because what I find is if it's after 9 months that babies start learning to crawl, they really don't get enough crawl time before they learn to walk, right? They need to have more of these cross crawl patterns, and I'll explain why here too. So why does it matter? Why does crawling matter? Well, it's how we explore the world around us. It's the first time we're actually really controlling the direction and how we're moving around in this world around us. It coordinates top and bottom, right and left, and that coordination with all of your limbs is what helps develop the communication between the two halves of your brain. We call it cross-hemispheric connections. That's very important for, like I said, earlier learning, but also, later learning, but it's also important for emotional regulation as well. So that's a pretty big deal. Crawling's my favorite. And integrating all of our sensory systems and our vestibular system together with one piece. There are aberrant patterns. A scooch is not a normal pattern, right? A bear crawl is not a normal pattern. Army crawl is a normal pattern, but should progress from there, okay? So those are aberrant patterns, and there's usually a reason. But we like to have babies early success in a good pattern, because if they get efficient at an aberrant pattern, they're going to want to keep doing that, right? That's the easiest way for them to get around. There used to be a Pampers commercial that showed all these adorable little babies crawling in all these funky ways. And you know what's really funny is they took it down. I'm sure the occupational therapists of the world just went after them after that commercial, because it was like, look how adorable all of these neurodevelopmental concerns are. And so I couldn't find it. I could not find a copy of it on the internet. They've completely erased it from the internet. But has anybody seen that commercial? Do you remember the one that I'm talking about? Yeah, it's gone. It has disappeared from the internet. But I have one of my own daughter. We were in an airport after a pediatrics course in San Francisco and made a whole bunch of videos. That's why I have these videos in the airport floor. It's the airport in Vancouver. So you'll notice with crawling, we're using opposite hands and legs. We're coming together. So there's crawling. How do you encourage success for crawling? Well, own the precursors. Own tummy time, own rolling, have lots of floor and explore times. I know I'm redundant on those, but they matter. Have different floors. So hard floors, carpeted floors, grass, sand, use some different textures. You will find that some babes like harder floors, some babes like the carpets. There's no right or wrong there, just give them different exposures on that. Avoid supported standing. This one makes me unpopular, but I'm not a fan of the jolly jumper and the eggs or saucer and any supported standing. From an occupational therapy standpoint, they're getting ahead of themselves. Right? From a neurodevelopmental standpoint, they're getting ahead of themselves. So if you avoid those, they are more likely to succeed in crawling, because if they figure out standing first, they're going to enjoy the vantage point, right? They're going to want to go to those standing things and skip that step. Cross crawl patty cakes are when we basically, every time you change baby's diaper, you can put them on the change table and play patty cakes with opposite hand and opposite foot, in the midline, in their visual field. This just helps prime those connections we're talking about in the brain between those two halves of the brain. Good job. And motivation. This is what my little post is here is about, this little video. It's my favorite one. Motivation. So get the cat involved, dragging a cell phone, you know, baby will follow. Again, this is where siblings can be really handy, right? We've got the dog, we've got the cat, you've got all of it. It's really fun. And using obstacles. So for those babies that you notice they're doing something only one leg, or they're really getting into it in a funny way, sometimes tunnels or stairs or obstacles can be a really great way to challenge them to use both sides. I find stairs work really, really well for this and like getting those patterns. But obviously, if you're working with a child on the stairs, it's very much like a supported activity, right? You're not alone crawling on the stairs. Beautiful. With this one, biggest thing we see with our little ones is usually pelvis and hips. There's a funny distortion pattern within the pelvis that can make it so that their early success is a scooch instead of a crawl. Those are things we can help out with. Sometimes it's shoulders, right? Sometimes you'll have a baby that it's actually something going on in the shoulder girdle, but most of the time it's the pelvis that we see with those guys. So last slide, I promise, then we'll get up and move around as we transition from one talk to the other. It's going to be perfect. We have our infant massage next, so we'll actually settle all the babies down next, which would be great. But get support. If you notice funny patterns in your little one, then get some help, get connected. The one thing I'll say is don't compare though. For one, this is not a competition, right? There's not my baby crawled first. There's none of that, right? None of it. And usually it'll be the parents who are really proud that their kid walked first, you know, walked really early, and that's usually actually not a good developmental pattern. So that's it for my talk. I think I might have gone a little bit over, but I had so much information that I wanted to throw you. We'll have time for questions. We'll be hanging around at the end too. So if there's something you really want to check in with, I'll be hanging around at the end.